All right, everyone. Well, thank you so much for the grace and for joining us again. So happy to have you all join for our second of three Mental Health Awareness Month lives surrounding all things mental health awareness. So excited to have two unbelievable pioneers join this incredible conversation, and we really look forward to a really great conversation today. So I'm just going to wait a moment and see if my amazing guests are going to come on. Hopefully they do. I'm just waiting to see have Allison join as well. So hopefully it works. Hey, how are you?
Hello. I'm so glad to be connected with you. Thank you for bearing with me. And here we are. It's like the first time didn't happen. We're having
That's
an
okay.
important conversation.
That's okay. That's a great. I'm gonna just wait to see where Allison is. Hopefully we can get her to join, and then we'll be good to go conversation with all of you today. Let's see if she's able to hop on. Hopefully it works. So
It's like you can get one or the other.
I know. Well, we know at the Active Minds account works, so hopefully it'll just pop on. But in the meantime, as we wait for Allison to hop on. I would love to take a moment and just let you share who you are and your role at MTV.
Sure. Well, thank you so much for inviting us into this conversation. I know this is, I believe, the second in your series for Mental Health Month, which is, we're so grateful that there is this time, but really it should be every day and every month, which is really at the heart of what we're doing. I work as a part of the social impact team at the MTV Entertainment Group, which is a number of brands, but MTV in particular has had a long history of taking on important social issues and health issues, and for which mental health has actually been an area that we've done a lot of work in over the last probably more than a decade, especially as it relates to young people. But as we all know, and it doesn't necessarily bear repeating what we've lived through over the last 15 months, whether that's the pandemic, the economic and political uncertainties that have been a part of that, so much loss, the fight for racial justice, that the stats don't lie and how difficult the time has been. And so we really wanted to do something meaningful in this month of May to shift our culture from awareness, as it's called the Mental Health Awareness Month, but to shift from awareness to action. And to do that with you, the Alliance, and Active Minds, and we're now more than 1,300 partners who will be encouraging and empowering people to take action tomorrow.
I mean, I saw the latest email and it said 1,300 partners from 32 countries. That just completely blows my mind. I just want to say on behalf of someone, I've worked in the mental health space for over 2 decades, and have an organization like MTV take initiative and say, hey, we really need to have a conversation. We really need to step up, because definitely out of all the things that you shared this past year, and everything that happened, I mean, definitely from our lens, I mean, we have seen unprecedented numbers. We had 108% increase in calls into our helpline in our searches. We had 183,000 referrals for care this past year. We know that the pandemic has incredible ramifications. I think one silver lining of this all is that we're able to have conversations we're having today. That tomorrow we have 1,300 partners from so many countries across the globe that are willing to say, we have to have a conversation. We need to step up into this space. We need to let folks know that it's okay to get help. It's okay to talk about it, and that they're not alone. And so kudos to your team, just because it's a game changer. It allows people to be seen and heard. And at the end of the day, there's is being seen and heard.
Absolutely. Well, thank you for being one of the founding partners. The vision for this day is that it belongs to all of us who are a part of it, sort of in the spirit of like a Giving Tuesday or an Earth Day, really being a day that is ownerless, and that each of the partners, and the partners are, brands and nonprofits and individual cultural leaders like athletes and actors and elected officials, and government agencies, all using the power of their voice and their platforms to reach people so that, like you said, we can have these kinds of conversations and help encourage people and empower them to take action for themselves, for a loved one who may be struggling, or to really build up the need for activism in mental health policy. As we know, there's a lot of issues of access and equity, and that there's a real need for doing more work on that side of things so that we can all have the mental health and the overall health that we should have.
I love that. And I'm so happy that you brought up, and someone just stated that it's really not enough to want help. It's getting access to care. And I know that's really big here at the Alliance. We believe we believe that treatment cannot be a luxury necessity. It's just a complete necessity. And just being so often it's above the neck that we feel like we should be able to, or that we should have enough willpower. What we say to all the time is like, it's no different than you can't will a broken bone to get fixed. You will away, depression, anxiety, eating disorders. I think I'm having a little bit of problem getting Allison on. I've tried several. I'm going to try one more time. And then I don't know why this is giving a trouble. We literally have tested this out many times. So
no worries. I think I was in her position before. There was something about maybe just one at a time kind of conversation, but
yeah,
by all means, yeah.
What I can do is let me see, let's try that. It should work now. The request came from her. She is such a rock star. Such a big fan of Active Minds and the work that she's done. So super excited to have both in this conversation.
Yeah, I was listening before. I was like, oh, I can hear them, but they can't hear me. And I know that they're having this is going to be such a rich conversation. And Active Minds has been such a major partner in our overall mental health campaign. And they have such a big presence with young people and people with lived experience, with eating disorders. And so, that is a voice that should really take precedence here for your community.
Yeah, no, for sure. We have shared Active Minds information so many times over the years. I'm just so happy to have such a resource. So it's not letting me add her. So what I'm going to do is, if you don't mind, I'm going to ask you. Oh, yep, they're going to try to update their app also, and then hop on. So I'm going to ask you a few questions, and then I'll be able to hopefully pull Alex into the conversation.
Okay.
So I guess my first question to you is, why do you show up in this space? Like, why is this work important to you? Because I feel like for so many of us that do work in the mental health space, there's some like personal drive there.
Yeah, well, I'll speak as myself, both where I'm coming from, how this is a part of my work, and then, of course, personally. I touched on it earlier, but this is really the first major activation in a broader campaign, which we're calling Mental Health is Health at MTV, which is really a refresh of ongoing work that we have done in mental health, in particular with young people, but that the experience of the last year plus and the intersectionality that we want to bring into the issue, because we also do work in racial justice and social justice and in other health matters. Did work in addressing the pandemic and being among the first to help people understand in just those first few days last March about, what is social distancing and the importance of masking up, and when that was what we needed to push. And even now, in our efforts to encourage people and to address, really honestly, vaccine hesitation. And so that's where we're coming from and I'm grateful to work in a place where that's in the blood of the brand and the people who work here, who think, how can we use our power as a media company, as an entertainment company? And, we have a lot of different angles. Comedy Central is a part of the MTV Entertainment Group, and I love thinking about how to use comedy to change the world, how to reach people, how it lets people's guards are down and we're open to hearing advice, and the relationship between comedy and mental health. I think with all artists and entertainers is well known, but these are coming up with new and creative ways to reach people, given how dire the situation is as it relates to a mental health crisis we've been living through. Personally, I've had my own challenges. And like you were saying before, the circumstances we've lived through have really exacerbated. I'm a mom. I have two beautiful sons, and I also live in New York City, and in a New York City living as apartments. And so in those days when we weren't in school and there were a number of us in a small space,
Yeah.
doing Zoom school and doing our jobs in new ways, it was very stressful. So it's been really easy to feel a personal connection to the need to help people, get help, because it's just been a personal experience for each of us. And I'm grateful to have not, I didn't get COVID, and nobody in my first, oh, look at that, she's here.
Oh, sorry.
We made it work. But yeah, there's a lot driving this work, and just really excited to have come up with something that brings two of our partners together.
That's so fantastic. Allison, yay, I'm so excited. You know what, I just I don't know, do a dance to the Instagram gods before. But I think what this last year has taught me is that I really don't
Totally.
control over things that I tend to want to have control over. Case in point. And I just love that we were able to all connect. And Erica, thank you so much for sharing what brings you to this work. I think that this past year has been extraordinary in so many ways for so many folks. I'm someone who lived experience with, I'm 20 years recovered from my eating disorder. That's one of the reasons why I do the work that I do. And I consider myself very privileged and lucky to have resources, to have supports. And I will tell you that this past year brought me to my knees with my anxiety. And I'm thinking, if I had this type of reaction, and I have the privilege of, having access to a clinician, taking what I need to take, having a supportive family, what must our community, our world be going through? And so for us, really quickly, we pivoted in a way to be able to support folks from one day to the next, because we knew that people were struggling and hurting. So I really appreciate you sharing, Erica. Allison, I would love to ask the same question that I asked Erica originally, is what brings you to this work? I know that you and I have something in common. We were both 21 years old when we founded our organizations. But why do you show up and do the extraordinary work that you do?
Yeah, I appreciate the question, and I think we're all in this for whatever reason that is, and we're all connected in one way. Mine is because of my brother Brian. I was a freshman in college when I lost my brother, my only sibling, to suicide, and it was this moment of reckoning for me of both trying to figure out who I was as a person, as a young adult, and as now an only child, and this idea that he had been struggling with his mental health, unbeknownst to me, for a very long time, not feeling comfortable telling anybody about it, thinking he was the only one, thinking it was his fault, all the feelings that we all have. And so for him, what that meant was that he did reach out for help, but by the time he reached out for help for him, it was too late. And so I started really thinking about what can we do differently and how can we both change the lives of people who are struggling and the lives of the families who have these holes, but just create an environment like we were talking about earlier where you know that you're not alone and you know it's not your fault. And when you look at the statistics and the age of onset, all of this stuff, we actually realize just how common mental health challenges are. But Brian literally had no idea that there was anybody out there who struggled like he did. And so that was, I started Active Minds as a student group. I was at the University of Pennsylvania. I started it at Penn. And then when I graduated, started the nonprofit at the ripe old age of 21 to really build a movement of young adult advocates to change the way America thinks and talks about mental health. And here we are.
I love that, and thank you for all the important and life-changing work that that you've done and you continue to do. And I have to say, it makes me so excited to hear about you starting it as a student group and founding the organization. One thing that I think has been so beautiful over the years is how when I started the Alliance, I very much didn't get the support because, it was this view of, you're a kid, you don't know much. Like in every meeting I went into, it was like, where's your boss? Like, where's your parent? Like it was, and now I think we do such a beautiful job at uplifting these voices, because that's going to be the change. That is the change. That is like the next. So I'm so grateful for your voice. I'm so grateful for your innovation and for your willingness to just create these conversations, because it's truly amazing to me, and I'm sure for both of you can relate to this, is whenever I start talking about what I do, sometimes I get the ignorant comment, but most of the time it's, oh, I experienced this,
Yeah.
or my partner experienced this, or my son, my daughter, my brother, my sister, someone. And I feel like when you start being able to vocalize it and create these conversations, then hope and light gets into the cracks a little bit, and that's when we're able to heal, which is so important. So would love to ask you, Allison, how has the pandemic affected the demand on the resources that Active Minds offers?
Yeah, so like everybody, we had to really evolve and pivot pretty quickly. I think also like everybody, the world is now paying attention to mental health in a way that they didn't before. And I think all of us here can talk about the fact that we've been talking about mental health for a while and trying to get people on board and knocking down doors and screaming from rooftops and all of those things. And now there's a lot of interest in this work. And so in some ways, I'm really proud that we were prepared and to do that and to be able to be responsive to folks. But for us, it's looked in multiple ways. We've really looked at our opportunity and responsibility to support young adult mental health at large. And so what that meant was opening up what was a Slack network just for leaders of Active Minds chapters to now a Slack network to all young adults who just want to connect with each other, who just want to share about the tips and tricks about how they're getting through school or what their latest Netflix documentary binge is, or I'm not doing well today, does somebody want to just be here with me tonight? All of the things that youth and young adults just want to connect with. So we opened up that Slack network. We've opened up an outbound texting service. We have just looked to evolve to bring our programming and our training online. Our chapters similarly brought their mental health monologues that were planned for last April to be an online event and figured out how to do that. And I think one of the things that we've really recognized is that we're all paying attention to this right now. And sometimes what we need is just, what are the words that we use to talk to our friends or family who are struggling? What are the words to use to express how we're feeling? And that's where the work of Active Minds has really come in over the past year. And we're hoping that this focus on mental health is here to stay. And I didn't get a chance, Erica, to thank you for what MTV is doing and in creating this opportunity to put a stamp on things tomorrow, starting tomorrow, and then what is going to come out of this. And this has been an epic year with so many difficult things, and also though it can be a springboard, and I hope it is a springboard for what is yet to come with this focus on and the programming around mental health. So that's what it's looked like for us over the past year.
Thank you so much for sharing that. Erica, I'm just wondering, what do you believe, like some some first steps, and I know that they're not first steps because, like Alex said, like, you've been doing this for a very long time. But what do you think steps in destigmatizing mental health and having folks the facilitation? So I definitely know MTV's, or I should say, powered by MTV Mental Health Action Days, a first step. What do you believe the first steps are?
Yeah, well, thanks to both of you. It's so inspiring to know that you were both such young leaders in founding your organizations to address such important social issues. And that, here we are coming together. And just like you said, Allison, it's not just about tomorrow. We're hitting the gas from awareness to action, but it's going to continue. And yeah, I think the first actions really are, we've been presenting this as a menu because we know that, this is not a prescriptive day. But it's a day where we are hoping many more people will take the time to take a first action to figure out what works for them. And so, what we present in the context of Mental Health Action Day and the overall Mental Health is Health campaign is, it may be trying self-calming activities for the first time.
Oh, I think we lost her audio. Oh, Erica, we can't hear you.
As well.
See. Hopefully it comes right back on. Not yet.
I can see your lips moving.
Okay. We'll give Erica a moment. Would love for you to answer that question. What do you believe the first steps in destigmatizing, or in our words at the Alliance, smashing the stigma surrounding mental health?
Yeah, I believe really strongly that what we need to do is just start a conversation. We just need to start a conversation. We need to create a space, as we were talking about, that commemorates days and months like May and brings that into June and July and August and September. And so we can have an everyday conversation, which can change the culture to one where this stuff is actually asked about and answered. And so when somebody says, "Hey, how are you doing today?" You can actually answer the question, and you don't just have to say, "Well, I'm fine," and move on. But if we can have little changes like that and have little ripples like that, what that opens the door to is the opportunity for somebody to really be honest and truthful and get the support that they need, whether it's be friend or family or clinical, whatever it may be, as soon as they need it. But we not have to wait till the very, very end. So there's little conversation changes, there's little language changes, and that's so much of what we really believe in, and being a good friend and being a good peer to somebody around you who might be struggling.
Yeah, I think that's so true. And I think that, oftentimes by giving individuals the opportunity to just be seen and heard, I think can be a factor. I'm gonna go ahead and pull Erica back.
Yeah.
Grab her. Let me grab her really quickly. Let's see here. There she is. We sent her a request, and hopefully she gets back on.
Fabulous.
There you go.
There we go.
Oh, yay.
Yes.
Hi.
We roll with the punches. That's what we've learned to do in our new world.
I love that. I would love for you to continue what you were sharing, because Allison just so beautifully shared about opportunities, to be a friend, be a supporter, be showing up for folks. Like, do you believe that's like along the same things of,
Absolutely.
That opportunity?
Yeah, I was saying that, there's no one call to action as it relates to Mental Health Action Day. It is the things that you can do for yourself, of which there are many, and of which you all know the guidance better than I do, the things that can work that we should try. or to do for a loved one, for a friend that you know may be struggling, and to reach out tomorrow and offer that, that so people know that they're not alone. And or for your community. And we've got a lot of great partners, and I know Active Minds does a lot of work in the advocacy here as well. But I'm really excited about that sort of third piece of the work, because my background is in developing campaigns across social issues. And when I came into this work that eventually led to the development of Mental Health Action Day and bringing you on as founding partners, what the issue space seemed to lack or need more energy interjected into was in the context of activism and advocacy. And so a ton of our partners are also leading the way in figuring out what that means, how to advocate for change, whether that's within your school community, at the city or state, at the national level. There's just so much more work to be done to help people get the mental health access that they need, and so that people feel supported in our world.
And I would love to just piggyback on that, because it's so true. And I also think that in this field, sometimes it feels like it's hard to get in. It's hard to know where to start. And, from the very beginning of there's somebody struggling, you don't know what words to use, you're afraid to say the wrong thing. But even in getting into advocacy, how can one person make a difference? And one of the things that we're really encouraging folks to do this month for May's Mental Health Month is to sign a Here For You pledge, which is something that we launched at Active Minds with the basic idea that you can show somebody around you that you're here for them. It's to show up, it's to support each other. You don't have to have the right words. Sometimes you just need to say, I'm here for you. How can I help you? How can I be a support? We offer stickers and icons that you can put up through your social and actually put a sticker on your laptop, on your door, or whatnot. But it's a very easy way for a single person to get involved. And then with that and from that, there's so much opportunity to do more and to look at your school policies or to look at your community, your local, regional, national policy, and continue to build on it. But don't be afraid to start somewhere, because this is a scary topic. We haven't been taught this topic at all. And so let's start in one place for your own family, your own community, your own friends, and then you can build from there. I
love everything that you both just said. And like when you start talking about advocacy, that's sort of like my place where yes. In full disclosure, I totally slept through American government class, so I had no interest. It's not for me. And about 18 years ago, I was going up to DC to do an event, and a family friend of mine, said, "Why don't you meet with your member of Congress?" And I'm like, I have no idea why I would do that. And, so I went to Borders at the time, and I bought, one of those yellow for dummies. I bought Government for Dummies. And watched House rock. A bill is a bill, and I was like, I'm ready to go. With my member of Congress and actually not a staff member. And I remember walking into his office, and he was looking at me and he was like, "Why are you here?" And I was silent. I had no idea what to say. And that doesn't happen to me because I like to talk. And after a few minutes, he looked at me and he says, "What's your story?" And I shared with him my story. And that was the moment. And I love what you just said, Allison, that's the moment that I became an advocate. And I've totally fallen in love with advocacy. I've totally fallen in love with, working on policy. The Alliance was integral under the umbrella of the Eating Disorders Coalition to get the first ever piece of eating disorder legislation passed in 2016, to make sure that individuals got access to care. And I will tell you, we are not like unicorns. We all have this in us to use our voices to make a difference, to show up, because it can be everything from writing a blog to sending an email to exactly what you said, is just letting you know that you are there for someone. And I think that, we've talked about this a lot, this Mental Health Awareness Month, is I think sometimes people are so afraid to say the wrong thing that they don't say anything. And I'm here to say, talk about it, use your voice. I think so much of our fear holds us back that we don't. And so just a reminder that, just let people know, as you said so beautifully, that, I'm here, I'm listening. Please let me know if there's anything that I can do. So thank you so much for that. I really wanted to take a moment, and it was really important to thank both of you because I know Active Minds has been a beautiful job at this for so long, and Erica, I really wanted to take a moment and thank MTV on behalf of our organization, because for so often eating disorders are not part of the conversation. Individuals have this idea that eating disorders are a disorder of choice or vanity. We know it is serious mental illness. We know it has the second highest lethality rate of all psychiatric disorders, that someone in this country dies every 52 minutes as a direct result of their eating disorder. And by having organizations like TV and Active Mind saying, you need to be at the table, it's for the 29 million Americans in order to be seen and heard. So I really did take a moment and say thank you to both of you. I'm so grateful to be working alongside of you. I hope to be able to continue to work next to you because it's really important. And we know that eating disorders are never alone in the car. There's always depression, there's anxiety, post-traumatic stress disorder, obsessive compulsive disorder. So I just really wanted to say that, and really just to ask each of you this question is, for all the folks that are watching and all the individuals that are getting ready to start advocacy or get the wheels into for action tomorrow, what's one thing that you want people to take away from today's conversation? Allison, I would love for you to start.
Yeah, I would say first and foremost, your struggle does not define you, and your struggle is part of you, and you are not alone in this struggle. And there are countless people who want to help and support, and hopefully that's somebody within your close family and friend group. And if it's not, there are countless others of us who are interested. There's a National Suicide Prevention Lifeline. There's a crisis text line, 1-800-273-TALK, or text BRAVE to 741-741. There are resources and there are people who desperately want to support you. I will also say you can get more information about our pledge at activeminds.org/pledge. And if you know nowhere else to start, just go there first. Take that pledge for yourself and for the people around you. And I hope that kickstarts you into whatever world of advocacy and education and change behavior that's going to bake for you. We all have a role in this. This is only going to change if we all keep sharing our stories. And so find that safe place, find that safe space. Be you, be true to you, and we're just excited. We're excited to have you on board.
So beautiful. Thank you so much, Erica.
Really, yeah. And I would add, I'm going to quote one of my favorite public leaders, a member of Congress, Representative Ayanna Pressley, who often says that the people who are closest to pain should be closest to power. And your experience of going to the Hill and maybe not knowing yet the power of your story, your lived experience, is something that I want people to hold and know that there is no more powerful advocate than someone with the lived experience, with the pain that they are leveraging to help create change for themselves and for others. So in the context of this day, that we are really driving people to take action for themselves, for their loved ones, or their community, that that's an energy that we need to keep moving forward, and to reiterate those messages that we are not alone. We're continuing to do the work of normalizing conversations like this, of asking people how they are feeling instead of how they are doing. There's just so many little things that we can do to change our culture that will really make a difference and save lives.
So true. And I think that your broader campaign that, mental health, like, thank you. Just absolutely. And for anyone who is listening, mental health is health. Like, one of the things that is such a passion of us at the Alliance, and so many that have worked together, is, parity for mental health as physical health, because I don't think you can have one without the other. They're so intricate. And so I just, one of like our leading quotes here at the office is, you know, if you want to go fast, go alone. If you want to go far, go together. And that is how we're going to get the conversation started. That's how we're going to continue the conversation, and that's how we're going to be able to work towards equity treatment, equity in conversations, and letting people know that they're not alone. So I really want to thank you both. Thank you so much for being troopers with technology. Like I think that, you know, it's just a beautiful reminder that, you know, this is not going to be perfect. It's going to be filled with, you know, twists.
Absolutely.
But we get to show up for it. So thank you both for being partners. Encourage everyone to take action tomorrow. To learn more, go to Mental Health Action Day. Is that correct?
That's
the
it.
website.
.org.
.org. Definitely visit activeminds.org. You can reach the Alliance at allianceforeatingdisorders.com. But more than anything, know that you are not alone, that you are seen and heard, that you are worthy, and that it's okay to get help. So thank you both so much. I really enjoyed our conversation, and I look forward to a successful day tomorrow, successful rest of the month, and then every other day after. So thanks y'all so much. Take care. Everyone be safe, and we'll see you soon.
Thank
Bye.
you.
Thanks so much. Take care.